Hello, all my friends in TV land. This is Senior Issues, etc., and I'm your host, Vita Verdon. Go get your coffee, go get your Coca-Cola, bring a paper and pencil, because the subject matter that I have today is you, within your sphere of relationships in the culture we are living, know somebody that's going to need this information that is coming forward today. And the subject matter that we're going to be talking about is hospice. And I have one particular hospice in mind. It's called Rainbow Hospice. And I have one particular young lady in mind because we have started out years back. I think it's almost 10 years that we first came into contact with one another and realized we were both doing a pioneering form of work. Now, my guest that I have today, her name is Nancy Flowers, and she certainly has bloomed as far as I have been associated with her. She started out with being a nurse's aide, and her father ended up in hospice, and I think that lit the fire for her passion to come out. And she's going to tell us a little bit about herself, how she got involved, and a lot about Rainbow Hospice and how it's grown. It's so nice to have you back again, Nancy.
Nice to see you
so
as
nice
well, Vita.
Now you can look right into that camera right there. That's your camera.
Okay.
And you just tell them a little bit. They like to get the dirt on. They'd like to get the dirt on Nancy Flowers.
Well, thank you for having me here today. You're absolutely right. This is a longtime passion of mine. I have worked in the field of aging for over 40 years.
That's okay.
Okay. I've been in the field for over 40 years. And I...
Go ahead.
Okay. What started out, as Vita said, as a nurse's aide while I was going to college and graduate school, and became really interested in working with older adults, and particularly with people who were facing end of life. And have spent my...
But you actually started out as a nurse's aide.
I started out as a nurse's aide and worked, that's how I put myself through school. But it's also what got me thinking about being a nurse, working with older people and how to help best.
Well, before we go any further, is there anybody you'd like to blow a kiss to? Is there a pet? Is there a significant person?
My family, particularly my 90-year-old great aunt.
What's her name?
Her name is Catherine Beyer.
Okay, listen, we don't give little smacks, we give big smackaroonies.
So, to Aunt Katie.
Okay, I'm going to send you one too, Aunt Katie. That's for you. Stay well. She's ahead of me. I'm 86. You said she's 90, right?
She's 90.
So, at what point did you know, like in your tiny little world of wanting to be a nurse's aide? That's the beginning, right?
Well, that was the beginning, but what I really had wanted to do was to work, actually to get my master's degree in social work so that I could help counsel particularly older clients, older adults and their families, to help them make healthcare decisions, both helping them live independently in their own homes as well as to live with chronic and terminal conditions.
Okay.
So that is actually what my start was.
Now, you have been involved with Rainbow Hospice for a very long time.
Yes.
For how many years have you
I am going into my 10th year at Rainbow Hospice and Palliative Care. Started out there as the social work manager and then moved into this educational role that I'm in now about 5 years ago.
Well, what is your actual title with Rainbow Hospice?
I am the Community Education Program Manager for Rainbow Hospice.
Okay, so now I want you to decode that as the
Yes.
Community Educational Manager. Are you the person that is writing the curriculum for the training sessions?
I am one of the staff that does both, that trains our staff on how to care for people who have a terminal illness and are in hospice, but I also provide education to community members, long-term care facility staff, anyone that will talk to me about what choices are available when we're
from
facing.
where I'm sitting, that is a wide umbrella for,
Yes.
first of all, what type of diseases are you covering?
Okay.
That's elementary. Then, in these diseases, what are the cause and effect?
Okay.
And what are the different, I don't know if you call them plateaus or levels or stages that a person goes through, because there's always a process of levels.
So maybe we should start with that for someone to come onto hospice, their physician has to believe that they have 6 months or less of life expectancy. So that's the Medicare rule.
Okay, so that's what the insurance calls for.
Yes.
Okay.
And it can be for any medical condition that's going to cause your life to be shortened. So it might be cancer, it might be multiple sclerosis, it might even be dementia, it might be a heart condition of some kind. Any condition that's going to result in your life being shortened and causing your death. So that, it's kind of broad. Each of those conditions has different things that Medicare has us look at, evaluate before we can approve the person to come on. But the short rule is that your physician has to believe that you are terminally ill, and you and your family have to, make a decision about whether or not that's the focus of care you want. The focus is comfort.
Well, like we talked before the show, it's not a one-size-fits-all.
That's exactly right.
And that each individual person in each individual categorized could have individual private things that are just happening to them and not anybody else.
And what's so wonderful about hospice is that it is personalized. So what hospice focuses on is what's important to you right now. What does quality of life mean to you? What kind of care do you want to have at the end of your life?
Well, I know there's something that you mentioned just prior to us coming on the air that I think is very significant to be mentioned, and that is that at 3 o'clock in the morning, if a person is in hospice with somebody and something has occurred they're not aware of, that it's okay, there's a place to call. And I think that tells a whole volume about.
There's a whole team of people that are part of hospice care. Physicians, nurses, social workers, chaplains, volunteers, music and massage therapists, all of those individuals care for the person regardless of where they live, whether that's in a home or a nursing home or visits them in the hospital. And the big thing that we provide is education and support to help the person understand what they're experiencing, for the family, teaching them how to provide that care, teaching them about medications that will be helpful to them. And yes, if at 3 in the morning the person is in distress, there's something going wrong, and you as the caregiver are not sure what to do, you can call the hospice and ask for guidance and help. And they will send someone out if that's what you need at that time. So that's a really important part of the work that we do, is that education and the care, whether it's during the day or after hours.
Well, I think I'm estimating it pretty close, but I think at about 6 years ago, it started changing. Prior to that, it was strictly someone was in the last stage before they went on.
What you're referring to, I think, the changes is the development of palliative care programs that are available to people who may not be terminally ill, but may have a condition that affects how they function. So
Would that something like be cancer?
It might be cancer. So it's physicians and nurse practitioners, sometimes also social workers and chaplains that are part of care, either in the community or often in a hospital setting, where these teams can provide consultation to you and your physician about how to manage symptoms. It's kind of like you pull in the cardiologist or a pulmonologist or a rheumatologist. The palliative care team can come in and provide guidance on symptom management, on helping you be comfortable. And what what you were talking about, was that if I'm getting treatment like chemotherapy for cancer, chemotherapy can be hard on me, may give me all sorts of side effects. Palliative care can help manage some of those symptoms so I can tolerate the care.
Now,
So
was that a conscious decision that's made, or did it just evolve out of the need?
Palliative care, it's the whole continuum of comfort care that yes, has come out of a need. And it's really been in the last,
say 5 years?
Maybe 10 years that palliative teams are starting to,
Yeah.
you're starting to see them in many hospitals, certainly in this area.
Well, I know the hospice care has really grown. Well, we're going to get back to it, but right now I got Vita's Pearls of Wisdom. Now, what I have online, I haven't got it counted exactly, but I think there's probably about 125 different types of shows. Now, you're going to find shows on legal management. You're going to find shows on emotional management. You're going to find shows on financial management. And you're going to find shows on physical management. Now, if you go onto the website, how you get it is seniorissues.org. Etc. is etc.org, and that'll bring you to home page. And on home page, you'll see our friendly faces. You see the face like this, and then you'll see there's a box, and the box says programs. And if you press that button, then a whole bunch of little boxes, little rectangular boxes, will pop up, and you'll find underneath it a word that describes what the program is about. And I think we have such a variety of issues. I have it from everything from emotional comfort to medical marijuana. So if there's something up there that you're not seeing, don't fear, give me a call and I'll squeeze it on, because the reason that this show even exists is that we are presenting this, my crew and myself, we're presenting to you in Lake County and surrounding areas. We started out in 3 areas. We started out in Libertyville, Mundelein, and Grace Lake. 3 little communities. Now I think we're up to about 155 different communities that we're plugged into or we mail off to. So in the last 19 years, started September 19th in the year 2000. Now, one of the things that I get several calls a week on, and that's a constant, is so there are people that really need this, and that is to contact SHIP organization, that's Senior Health Insurance Program. Now, a lot of people don't understand this, that is a part of Medicare. Now, there is a website for Medicare, and what you could do is you could go onto that website if you have the technical wherewithal how to do it, and you could assist yourself in picking out all the drugs that you need for your particular medical condition. Or in every community, they have what they call a ship representative. And the ship representative, I know a couple places they are in Lake County. One is at Park Place in Waukegan, and they have a ship representative in the senior center there. Her name is Loretta Pablo. And then there is another gal that is in the Lake Forest Senior Center, and she's a ship representative. But you just go, you don't even have to go in there. Just call the reference desk to say that you're living in Evanston. So call the reference desk at your Evanston library and ask them for the closest ship representative. And they're usually very close to a library or very close to a senior center, if not in the senior center. And they'd be more than glad to pass the information on to you. And I'm sure that if you search through the 125 different programs that we've presented it to you, you know, it's not that we're professionals, that we're all volunteers here and we're just bringing information forward. I'm sure you'll find that there is, if not one, several different programs that will help bring you through. Or I have had several lawyers on how to do your own inheritance, or how to do a lot of things legally that you don't even need to hire a lawyer, that you could do it for yourself. So we're out there, and if there's anything that we seem to have overlooked, I want to give you my telephone number and I want to give you my email. I want you to know I'll get back to you within at least 24 to 48 hours. My telephone number is Vita Verden, V-I-T-A, V as in victory, E-R-D-E-N, area code 847-573-1233. And that my email is Vita Verden, small casing, at Comcast.net. Now we're going to get right back to Nancy, and she's going to update us on what is the future for hospice, and she's going to tell us about Rainbow Hospice and what does a person need to do to get involved in it. So Nancy, we're right back on it.
Okay. One of the changes that I think is happening with hospice, some people worry that they have to have a do not resuscitate order in order to come onto hospice, and that's no longer the case. That discussion about how you want, what's important to you in terms of your health care and how you want your doctors to respond if you become very ill is an important one, but you don't necessarily have to have made that decision when you go onto hospice. Another thing that I think is changing in the hospice world is you used to have a live-in caregiver or someone who was available to provide your care when you went onto hospice. More and more of us are living alone, and we may start hospice living by ourselves. And that's actually a national trend that we're going to have to look at as part of hospice caregivers, is how do we help support people where they want to live if they live by themselves.
Well, how you do it?
What we do is we have a conversation with people about at what point would you be willing to have caregivers come in to help work with you, or would you be willing to go someplace to get care? Because we do know that as death gets closer, we're not going to be able to care for ourselves. We're not going to necessarily even be awake for that part.
So that may really increase the person moving out into some facility, right?
It may do that. Many people also hire caregivers, or even may have friends of theirs that take care of them if they don't have family. Most of our people are cared for where they've been living and are able to make arrangements to have either caregivers come in or they go to some place where they'll receive that care. But it is a discussion that we're having more and more as people come to us saying, this is where I want to be.
Now, is this your job, like if something new comes up within the organization, your hospice organization, is it your job to go and interpret it and decode it?
It's both to identify what do our staff need to know in order to be the best caregivers they can be, but it's also to go out into the community and provide education about hospice and palliative care and how people can, what those services are and how they can obtain them for themselves.
You probably always need volunteers.
We do always need volunteers. Hospice is one area of health care that's required to have volunteers. 5% of the work we do needs to be done by volunteers. So we welcome volunteers joining us. I'm actually part of the staff that train our new volunteers that come on, and they do everything from working in the office perhaps to sitting at the bedside of someone who is dying. And the hours we require for them to be involved with us can be as minimal as a couple of hours a week, but we are oh so grateful for our volunteers.
So it doesn't need to be like a 30 or 40-hour week.
No, not at all.
It could break it down.
Absolutely, absolutely.
And that you have a training center?
We do. We train our volunteers for the most part in our Mount Prospect office, but because we cover 9 counties, we look for volunteers that live throughout that 9-county area. So we might do the training in our main office, but then people would volunteer closer to where they actually live.
Now, do you have a website that covers the 9 counties?
We do.
Could you tell us what that is?
It's www.rainbowhospice.org, and that has a whole section in our website on volunteering, as well as our educational offerings and the services we provide.
And your educational offering, now where is that done? Is that done within a certain area?
Throughout that night, I actually provide education, and other staff throughout the 9-county area we care for people in. So as far west as Elgin, Aurora, south to Joliet, east to the lake, up and clearly up in this area as well.
And I know that you said, you know, when you see certain changes, you get excited. Mm-hmm. Why don't you tell us what excites you, Nancy?
The passion of, I think, anyone in hospice, not just me, is being able to help people to have as good a death, as comfortable a death as possible. We want to support them and their families in care. We want to be able to provide them the education they need so that they're less afraid at end of life. I've been on the other side of the bed. You mentioned my father, and so I've had the experience of caring for family, of caring for friends. What helped me most as a caregiver was understanding what I was seeing and what kind of services would really help me to help my parents or my friends as I cared for them. So understanding symptoms, understanding medicine that's going to be helpful to manage those symptoms, and understanding the emotional response I had when I was scared, when I was sad, that was normal, and that this team was going to be there to help me provide that care. That's what excites me, is to be able to do that well.
Now, I know that so much of this comes through Medicare.
Yes.
Okay, so and Medicare requires certain things. Mm-hmm. What are some of the requirements?
Medicare, thank you for bringing up. Medicare covers hospice 100%. So there are no costs to the person or their family, which is really important. The things that are covered are the medications, the equipment that's related to the medications and the equipment that's related to whatever the hospice diagnosis is. So if it's cancer, it's focusing on pain and things that are going to help you to be able to function well. All the service, all the people that come out to see you at home are covered. There are other things in there like respite that is a wonderful benefit. If people have to be cared for at a hospital level, that's called inpatient level of care, that's covered. So there's a real wide variance of things that are covered,
Well, one
and
of
we
the things
explain
you
that
men-
to people.
You mentioned that Medicare requires, well, it doesn't have to be exactly the district.
So the requirements from Medicare, there's a lot of them, but we explain to people when they come on to hospice, they have to be within, within, their doctor has to determine that they are probably have 6 months or less to live. Once they're on hospice, we are continuously evaluating that they still need us. And they may live longer than 6 months, but still need our care. And some people may actually start to do better because they're getting the right medicine and the right care, so they may actually graduate from hospice.
So, you know, I wasn't aware of, because I thought about that. I was not aware you could graduate, and then if you needed at a later date.
You could come back on, and that does happen. There's interesting studies that show that sometimes people get better on hospice because we're giving them the pain medicine they need, so their pain is managed, they start to feel better, they have the right care. This particularly happens with conditions that have a long decline, like dementia, multiple sclerosis.
Do they know they graduate?
We talk to them about that.
Is
We
there a
prepare them,
graduation?
and then we make sure, it would be nice, what we make sure is that they have the services they need once we discharge them from hospice. So we have conversations. The other thing is that people can change their minds. If they decide they want to resume treatment for something, they hear about something that maybe they think would help them, they can stop hospice and go back to their conventional care. So that's an option as well, and some people do that.
And then I know we talked about this earlier, but I think it's an important thing because there are a lot of people that are living alone today. And so this would require either bringing in somebody for care or for them going out and getting some care.
Yeah.
So it may just be on a temporary basis. It doesn't have to be.
Part of what the team does that comes to work with family, patients and families at home is to provide that education. So someone might start at home and maybe even start at home living alone because that's what they want to do. As their health changes, they may need more care. So the team is going to be talking with them about how their care is working at home right now and what services are available to support them as their condition gets worse. So
Well, Nancy, maybe you could give out a telephone number and the
Absolutely.
website one more time,
okay.
because somebody may be needing that right now.
So our hospice's phone number, Rainbow Hospice and Palliative Care's phone number is 847-685-9900, and the website is rainbowhospice.org.
And when you out there, you're the one sitting on the couch, come to the end of your rope, you tie a knot and hang on. You know why? What we want for you to do this week is to catch the spirit.